Hi, my name is Ben Lankester. I'm a knee surgeon from Somerset in the UK. This is a short video about surgery for a torn cartilage or a meniscal tear. I'm going to show you two different types of meniscal tear and show you what a surgeon means by trimming or repairing your cartilage. There are some videos here from the inside of the knee, so please don't proceed unless you're happy to watch these. The most common pattern of tear is a degenerate meniscal tear. This one is in a female patient aged 52 who has had a sharp catching pain at the inside of her knee for 3 months, not settling with physiotherapy. This is the view we get at keyhole surgery, and you can see me here probing the loose catching edge of the cartilage pad that sits between the curved end of the thigh bone and the top of the shin bone. And now I've introduced a shaving device through the same small keyhole incision to carefully trim, removing all of the loose catching edge that's going to be irritating the patient and causing symptoms. And you can see here the rest of the knee is entirely normal with very smooth surfaces and no evidence of any arthritis. And now I'm going to show you a different type of cartilage pad tear that needs to be repaired rather than trimmed. This one is in a teenage male patient whose knee has locked so he can't straighten it. Again, probing to start with, you'll see that the whole cartilage pad was stuck at the front of the knee. I've pushed it to the back where it belongs, just carefully assessing it, and then I'm going to hook over the back and see the whole cartilage pad can flip to the front of the knee. And we call this a bucket handle tear because it can flip forward and back like the handle of a bucket, and this needs to be repaired. We have a clever all-internal stitch system. You can see here a sharp needle being used, which is going to get pushed through the cartilage pad and beyond, which will deliver a little plastic button with a suture attached. That then pulls back again. And then you can see the suture there, the blue and white suture. A second pass is done, delivering another button, and then pulled out of the knee. And another device is then passed over that thread to tension the knot, and when this is just correct, to cut the suture. These are the surgical devices I'm using to deliver these internal stitches. You'll see there are different curved versions at the top and then the tensioning and cutting systems at the bottom. The whole orange bit stays outside the patient with just the narrow section going into the knee. So back inside the knee, a second suture is passed, again with the needle. You may see the first one just behind this one, so we're slightly in front of the first suture. Again, 2 passes to deliver that next stitch in. That one will be tensioned, and then a third one at the back of the knee I've switched around, so now coming from left to right to pass one final suture into the back of the cartilage pad. The little yellow bits you can see floating around are small sections of fat, just ignore those. And again the suture is passed and then carefully tensioned to make it nice and tight, just the right tension before it is cut. And then final shot here, just showing those 3 sutures around the back of the cartilage pad holding it in place. So I hope I've shown you what your surgeon means when they talk about trimming your cartilage or repairing it, and you've seen those are 2 very different things. For more information on this and other orthopaedic conditions, please see our website.